conversation about vaccines called Let's Talk. We are honored to have so many distinguished guests with us at this conversation. My name is Samantha Perlman. I'm a Marlborough City Councilor at large, and I am joined by my co-host, Ayesha Wilson, Cambridge School Committee member, as well as the Greater Boston Association of Black Social Workers. Before we jump in tonight, we did want to take a moment to have a moment of silence to mourn the loss of several lives and several of the murders that have happened over the last week or so. The one that happened in Atlanta last week, many of whom that passed were Asian women, as well as the one that just happened earlier this week. Thank you. We are in solidarity with the AAPI community and condemn any form of racism that targets them or any other group. And for this conversation around COVID-19, we have seen the Asian American communities continue to be targeted in the pandemic and want them to know that we are your allies in educating and dismantling this hate. I will now turn it over to Ayesha for some more overview for our event.
Thank you so much, Samantha, and thank you to all for watching and joining us today. So the first part of this conversation will be to focus on the medical science of vaccines and conversations with our doctors and scientists and medical health professionals. The second half, we'll dive into the community perspective on vaccines and hear firsthand experiences from those directly working with residents across the Commonwealth. And we invite all panelists and participants to stay on for both parts of the conversation. We're going to be watching live we're here on Facebook, and we will then be streaming to YouTube afterwards. Unfortunately, our YouTube, we weren't able to set up both Facebook and YouTube at the same time. And that's the technical glitches that happen in this virtual world, which we're all excited about, but also having our challenges with at the same time. But we totally look forward to thinking about how we are debunking the misinformation around the vaccine and how we're going to share the importance of making sure that, that everyone who chooses to be vaccinated is vaccinated and that everyone is educated around the vaccine. This is super, super important, not only to me personally, and I'm sure to Samantha as well, but also to our community and the individuals on our panel as well. So thank you all so much for participating, and let's jump in. So I am going to introduce a few of our medical and scientific panelists. First, we have Dr. Basu. Dr. Basu, if you want to take a moment to introduce yourself.
Sure. Hi, everyone. Thanks for having us. My name is Gaurab Basu. I'm a primary care physician at Cambridge Health Alliance and an instructor at Harvard Medical School. And I co-direct a center called the Center for Health Equity Education and Advocacy, which is a center that works with healthcare professionals to engage in issues of social, economic, racial justice, and think about how health community COVID team. So we've been taking care of a lot of COVID patients, and also as a racial justice educator. And so a lot of my work and my medical education work is really thinking about systems and thinking about history and ways in which we have served communities and ways we have not served communities. And the truth is that we have a painful, festering, continued history of racism that's permeated every part of our healthcare system. And that there is good reason for people to have had a very complicated relationship with the healthcare system, as they do with the broader US society, right? And so what I have seen during COVID is a lot of these fault lines of injustice, fault lines of inequities, all of those fault lines have really been turbocharged during COVID, right? This virus has kind of saw the different fault lines of the ways in which we've had inequalities and injustices in our society, and it's activated it to an even higher level of harm and pain. And as a clinician, it's been heartbreaking for me to see, as a primary care doctor who takes care of a vibrant immigrant community, to see my patients struggling and knowing that there's a lot of structural issues at play is something I try to do in my advocacy work. So it shouldn't be a surprise that things played out this way during COVID and continues to play out in COVID, and also plays out in the vaccine story as well. So we're now in this phase of the pandemic in which we are trying to distribute vaccines, and clearly kind of the vaccines are a critical part of us getting out of this pandemic. So I think maybe the messages I'll just kind of end with here is that that I think vaccine equity, there's many issues to talk about in this this domain of the pandemic. I think it's critical that we distribute these vaccines in a way that's accessible and proximal to communities of color who have disproportionately dramatically be impacted by COVID. That's true in Massachusetts, that's true around the country, that's true around the world. So it's critical that everyone who wants a vaccine has easy access to it. And frankly, we've got some work to do that. Number two, it's important that you just have good information, and that's what we hope we can do here, with a recognition of this history that we are operating with. So I think all of us here hope to be trustworthy messengers of that work. I don't have any presumptions of whether a community is hesitant or not. I want to be available and to speak to our community, but frankly, there's large swaths of many kinds of communities in the United States that are expressing some kind of hesitancy. So I come in with no assumptions, but eager to kind of be in relation with my patients and to navigate this, this whole pandemic and this phase of vaccine distribution as well.
Thank you so much, Dr. Callahan.
It's the elephant in the room. It's been the elephant, the racism has been the elephant in the room for many years, and not just the healthcare. And I think that there's the thought, why should certain populations trust the healthcare industry that has not served them historically? The word "should" is kind of is tricky, because there are a lot of reasons not to, very valid reasons. And one thing that I've noted with talking to my patients, I'm a pediatrician, so my patients aren't actually getting access to the vaccines, those that are under 16, but the parents are very, very concerned about the speed of which the vaccine was created. And I hope that we will talk a little bit about the way in which it was made and why it came to us so quickly. But there is this underlying thought that Black and Brown communities get the leftovers in a lot of ways. And I think that addressing that straight on, naming it straight on, and not trying to have a conversation around it, which would try to convince a group of people not to believe their own history, is the mistake that we have made a lot in the area of science in general. Understanding the power that history has in a person's judgment, and then the power of fear in making irrational decisions out of that context. So I think that that Gaurab covered most of the issues that we see with racism. We have to understand that it is bigger than the healthcare industry. This society that we live in is built on that premise that there are certain groups that are a little less than human and not having a right to what everyone else has a right to. And when I'm speaking to my patients, I call it out, I name it, and a lot of discomfort from that, but actually sitting with that discomfort is what we really need to do. And so that's, yeah.
Thank you so much, Dr. Callahan. Dr. LaRocque, my question to you is, what do we need to acknowledge about racism in medicine in our country's history?
Well, I think that Dr. Basu and Dr. Callahan pretty much put the finger on it. I think that we have to acknowledge that it's an important factor in what's going on with COVID now, in addition to being part of our history. And I think that it's very, it's very difficult to have these conversations without acknowledging the true failures of our society currently with COVID. We have seen remarkable statistics, that there has been a loss on average of lifespan of 1 year for white Americans and 3 years for Black Americans. We've seen here in Massachusetts, the age-adjusted mortality for COVID is 3 times higher in our Black neighbors and friends. So these are statistics that we are seeing, here and now, and on a very personal level. I've spoken to many communities about the vaccines and about COVID, sharing my knowledge, and heard incredible stories about communities of faith that have lost more than 100 pastors over the last year. I mean, it is truly devastating amount of loss, and so you can't not acknowledge that. And I just think that's the starting point. But I think in the conversation where we are here today, we also need to provide information. We need to allow people to understand why the vaccine is an important component of our toolkit in protecting people from COVID, and share that information freely. And that is part of it too.
Thank you so much. And so just thinking about COVID safety and protocols, I'm gonna go to you, Dr. Crittendon, around what should people still abide by? What should people still be doing? How do they remain safe, whether vaccinated or not vaccinated? What does the community need to continue to do?
Yeah, I feel like the messaging has actually been a little bit confusing about that, because we learn, right, that these are fully protective for you to prevent you from getting severe illness, going to the hospital and dying. And so then why do you need to worry about getting a mild case? But the issue comes with the variants. And I think many people know, okay, it's something about the variants, but understanding what that is, I think will help people to understand why you need to continue with masking and making sure that you don't get sick. And that's because the variant that everybody's worried about coming about is one that will be resistant to the vaccination or reinfect people who've already been infected. And that would create a completely new pandemic, right? Because then everybody would once again be capable of being infected. And the most likely way in which that variant could be created, could arise, is in somebody who's immunized. Someone who's immunized either through vaccination or from having been previously infected. Because every time you get infected, then you have a whole bunch of viruses replicating in your body. And some of those are mutants, some of those are variants. And if one of those is a variant that can resist the immune system in somebody who's immunized, then it will be the one that takes over, and it can be transmitted to other people. And that's when disaster would ensue. And so it's really important for people who are immunized or think that, however they've been immunized by vaccine, to not get sick with COVID, because that increases the risk that they're gonna get that variant. And since the vaccinations are fully protective against severe illness, but not against mild illness, it means that you can catch COVID as somebody who's been vaccinated from anybody, regardless of the variant. And then you could be that reservoir that creates the one that is resistant to the vaccination. And so it's important both to not get sick, to wear a mask to prevent yourself from becoming the creator of the next pandemic. And also, if you do get sick, not to make other people sick. So it's the same reason for distancing and masking that we've always been practicing. We want to prevent ourselves from getting sick, and we want to prevent others from being sick, because 40% of people don't realize they're sick. And I think if we're immunized, we're going to be even less likely to think we're sick, right? Because it's less likely, but it's still possible. So that's why it's important until we reach herd immunity, right? Where it's not around in our community. But at this point, there are still many infected people in our community. And so your chance of getting sick, if you're not vaccinated, is reasonably high. If you're vaccinated, it's lower, but it's not low enough that we shouldn't be careful until probably June or July are the estimates now for when there will be low enough levels in the community that we can finally all relax and feel like we beat this thing.
Thank you so much. And so before we actually even talk about the actual vaccines that are out there, I want to go to Tracy Rose-Tynes and just talk a moment about getting tested and the efforts that you have led and supported within the city of Cambridge, particularly around testing sites for our educators and our students and more. And so thinking about when you're vaccinated, should you still be getting COVID testing?
Yes, the short answer is yes. So right now within the Cambridge Public Schools, we're testing everyone who's in the buildings. It's incredible what we have. I think we're probably the only district in the state that has this incredible testing setup. We are testing from grades pre-K right up to 12th grade and all staff. We are we want to test more and more students. It's about getting consents signed by parents, which is really important. But right now, the level of testing that we're doing, schools are pretty safe. We know when someone is positive, we're on it first thing in the morning. We're preventing them from even coming into the building because our contact tracing starts at 6 o'clock in the morning. We are communicating the positive case with the principal, who then calls the family. That child stays home. Or if it's a staff person, that staff person stays home. We're testing most of the staff are coming in for testing now. It's twice a week. We're pool testing the little ones who are pre-K to 5. And it's just been incredible. It's such a great feeling to be able to say that our schools are safe. I mean, it's not perfect. We still see cases pop up, but we are in a really good place. We're really fortunate in Cambridge. So for us, we are also letting people know as more and more staff are getting vaccinated, we are absolutely asking them to still come in, even when they're fully vaccinated. And 2 weeks into that, where they're fully protected, we're still asking them to come in and be tested because, like Dr. Crittendon said, we can still pick up the virus. We can still transmit the virus. So we want to be sure that all staff are negative. So, and for right now, students soon enough, I'm hoping this summer we'll be able to also vaccinate 16-year-olds with the Pfizer vaccine. And we're really looking for that herd immunity because we are not there. Restaurants are opening and gyms are opening, and it kind of confuses people because they think, well, if people are in a restaurant with their masks off, it must be safe, it must be okay. But we are not there. And really, we have to stick with the mitigation strategies that we know that we've been living with for a year. We can't let our guard down now.
Thank you so much. And so let's talk about these vaccines real quick. Dr. Callahan, or Dr. LaRocque, anyone who feels, so we have 3 different vaccines. We have the Moderna, the Pfizer, and the Johnson & Johnson. Do I get to choose which one that I want? Do I get to, they have that saying, beggars can't be choosers, but in this case, does that matter? And does that matter, especially when we're thinking of race and, Black and brown people and thinking of which ones that they might gravitate to more? Does anyone have a thought about or anything to share to our community, and maybe even just debunking some of those thoughts that might be out there around which one to choose and why all 3 are effective? Yeah, Dr. LaRocque.
Well, I'll just say the simple answer, which I tell all of the people I've been talking to about this, is that the best vaccine is the one that you can get. So you don't really get to choose which one you're going to get at any given location. And frankly, all of the vaccines that are authorized for use right now in the United States protect against severe COVID, hospitalization and death from COVID. And of course, that is what we are most concerned about as individuals. And so I think the message is you should get the vaccine you can get. I just want to give a thumbnail of what I say to a lot of people when I talk about these vaccines, which is just to acknowledge that, of course, we saw they were developed over what seemed like a pretty quick time frame over this last year. But it's really important for people to understand that they were developed on an understanding of biology that has been in place for many, many years. And the tools and the mechanisms for developing these vaccines were actually kind of put in place after the last time we had a near miss with the coronavirus pandemic, with the first SARS virus. And so we were able to capitalize on that knowledge in order to move this process forward in a way that helped us benefit from that known biology. So it didn't come out of nowhere, is an important message. And also, these vaccines did go through the exact same process that all authorized vaccines go through in our country before they're approved for broad use. They were studied in tens of thousands of people. People were followed very carefully. There were scientific panels and panels of doctors who reviewed the evidence before authorizing the vaccines. And we also have in place a number of systems to monitor people for adverse events after the vaccine. So they've all been through the same process. They all have very good protection against severe COVID. So the one you can get is the best one.
Can I just piggyback on what Dr. LaRocque's saying is that, I think it is important to kind of highlight, to address any concern that this was a rushed process or a speedy process. And I think Dr. LaRocque did that nicely. But to know that it was an extraordinary effort, and it definitely was a much shorter timeline than historically vaccine development happens. There was an infusion of just an unprecedented amount of money to enable that. And then the historical work done previously also, I think, set us up. So maybe I can just say a quick word about the mRNA platform specifically, because that's the kind of the newest version. I'm really excited about this mRNA platform being a way in which we do vaccines now and into the future. And one thing that I think is important to know is that while it is a newer platform, this has been used for vaccines used in cancer care previously as well. And the mechanism in which it works is really fascinating and safe, and actually in many ways has less of complications that we could think of in other kind of mechanistic approaches with vaccines. And so I want to also just kind of pinpoint that the mRNA vaccines have no ability to get into your DNA or the nucleus of your cells or anything like that. I'm not sure if anyone has thought about that, these words, we think back to biology in high school and things like that. But in that way, it doesn't get close to doing it has no ability to do anything like that. And so I am quite excited about the mRNA platform and wanted to address the kind of idea that it was kind of a newer platform.
Thank you so much for that. Dr. Callahan, yes, please.
Yeah, just to piggyback what everyone has already said, that is one of the myths that I've had to debunk very, very frequently, that the conspiracy, there's a conspiracy to change my DNA. Now, think about that in communities of color. Think about that in a context where they're submitted to a notion that there is a supreme race, and this supreme race is generating something that might change my DNA. It's not totally, it's not true, but it's understandable that people would fear that. And the question I'm given all the time is like, is this going to make me a different person? And it sounds simplistic, but that is what I'm being asked. Is this going to change what I look like? Is this going to change what my children look like? So it's very important to explain that this messenger RNA is not going anywhere close to one's DNA, which is how you're defined through your genetics, but that it's a way to educate your body to make an antibody, to make a protein that can fight against COVID. The other thing that people ask is, are you giving me COVID to protect me from COVID? Is this a living organism that you're giving me? No, it's not. And I think that is also And we need to make sure that people understand that these are fragments of the COVID virus and not a living virus. And then lastly, why did it get produced so quickly? Explaining that it's a new technique for vaccines. People think about the flu vaccine. Why do you keep telling me it takes a year to make the flu vaccine? And this one took months. And to explain that it is not cultured. This particular vaccine can actually be produced and reproduced in a lab, as opposed to culturing it in eggs, then isolating, the component that you need, purifying it. All of those steps are bypassed because of the technology that we use. And I think the comparison that people are making is the old flu vaccine. And I tell them that it takes a while to get the right one. It takes a while to produce it. I've been saying that for years. And then all of a sudden there's one that's ready just like that. So I just explaining it at the very baseline is what we need to start doing, and not assuming that they understand. Yeah.
Thank you so much, Dr. Callahan. And so we are going to be transitioning from the medical science talk into community talk. And I'm bringing in some folks to join us, some wonderful community leaders across our state. So we are welcomed and joined here by Pastor Tallis out of Marlborough. So if you want to just spend a moment to just introduce who you are.
Hi, everyone. Thank you for having me. I'm Pastor Tallis from Bethel Presbyterian Church. I'm a pastor of a Brazilian community in Marlborough area. And we are, most of our people, Black and brown, of course, and we are from Brazil, and we live in here as immigrants. And we have, we really feel the welcoming way that Massachusetts has received us. So we are here, and I'm, as a pastor, of course, I'm not just talking about Bible, but I'm talking about healthy. And that's the reason because I'm here. I'm support the idea of the vaccination, and I'm trying to help my people to understand how important it is for this to go out of this pandemic with the vaccination. Thanks for having me.
Thank you so much. We are welcomed here by Boston City Councilor Julia Mejia. Julia, if you just want to share a little bit about who you are and what you bring to the table.
Sí, buenas noches, ¿cómo están todos? Don't worry, you don't need a translator. I was just checking and making sure you are all paying attention. I'm Councilor at Large, Julia Mejia from Boston. I'm an Afro-Latina. I represent 700,000 constituents throughout the city of Boston, all 22 neighborhoods. And COVID is something that in my own family, I've experienced loss, and through the constituents that I serve, I see the importance of this conversation and looking forward to the dialogue tonight. Thank you for inviting me.
Thank you for joining us. Ms. Rosalind Baker.
Hi, thank you for having me as well. My name is Rosalind Baker. I work in human services in this area, in the Metro-West area. I'm actually a director of a family resource center right now, and I am also a public health student. So but I can see how COVID has impacted the communities that I work with. It's impacted my family as a person of color. And I really want to get the word out and really just kind of acknowledge people's fears, but give them the right information, give them the factual information so they can make the decision to get a vaccine. And it's working slowly. So I'm really happy to be here to talk about this.
Thank you so much. And Professor Tony Clark.
You can call me Tony. My name is Tony Clark. I'm a professor at Bunker Hill Community College. I'm also still a professor at the CUNY in New York City. I'm also the president of My Brother's Keeper Cambridge. So I'm excited to be here. And as was mentioned, I have personally been impacted by COVID, the loss of several family members, but it's an exciting conversation to be part of. Thank you.
Thank you all so much, and I'm very excited to have you all here. And some of you touched on this in your opening, but we want to kind of hear a little bit more about how COVID-19 has impacted you or your family, and appreciate people already sharing some things. And if anyone else wants to kind of open the floor, it's kind of an open question to learn a little bit more about how it's impacted you.
So I can talk a little bit more around just kind of the social and emotional and mental health impact of COVID. I think that oftentimes we talk about the financial, the learning loss, and all these other things, but often the mental stressors of COVID really we don't dive into as much as I think we need to. You know, when COVID first came onto the scene, not knowing what it was, you know, there was a joke at the beginning, we're like, oh, that is so far away from here. Oh, Black and brown folks don't get it, because at that time I hadn't heard of anyone until the Utah Jazz player, basketball player came out, and we were like, oh, wait a minute. And I think that there was a big shift in communities of color when we started to see that COVID was hitting everyone. That changed the dialogue, and I think that the intensity of just the fear, but the mental health component of it, you know, my mom got laid off, and so she was consumed by the television and all of the images of, you know, the death and just how scary it was. And then my daughter was remote learning. My daughter was 10 at the time when COVID first came. My mom was 71. I had two different age groups, both who were very in need. So that mental health piece of it, and trying to grapple with the realities of the fear that so many people were living in, really impacted me personally, to carry the weight of these two different extreme age groups. But then everything else that was happening in my community, I think that mental health and wellness, COVID has really played a big role in that space for me.
I'm glad you touched on the mental health aspect. I know for the communities I work with, the isolation and the isolation for those who already had were already living with mental illness or substance use. The isolation there, and we're looking now at the impact of when we finally do come out of we hit that new normal, that we're looking ahead just to make sure we are prepared to work with people who have been impacted by this in ways that you don't know until you have those conversations with them. And just the impact of kids going back to school, the anxiety, the anxiety of them going back to school, preparing for those sorts of things with some of the schools in our area. So I'm glad you touched on that piece, because it is important. And I think we should, I'm talking about preparing for it now. And I just hope everybody is kind of cognizant of that.
As immigrants, I can tell you guys, it's hard to be here in the US, and we have a good expectation about the future when we talk about vaccine. But Brazil lives now the worst moment in the pandemic. In almost every day, I have to express my grief for some family, from friends, or members of my community. So it's so sad, it's so hard to live this moment. And I can talk about my community. Everybody's so sad, everybody's so worried about the situation in Brazil. Of course, we are excited about the expectation, when we talk about the expectation of the vaccine here in Massachusetts in the US. But I had COVID at the beginning of 2021. My son, my older son, had in 2020 light symptoms for everybody when I'm talking about him and me. But still, we still feel this challenge about the sickness around our people. And maybe another moment I can talk about our community, because the whole community, I'm talking about Brazilians here in the US, are so worried, so sad. It's hard. it's a really hard moment for us.
Thank you all for sharing. We really appreciate that. And for everyone who's, lost a loved one in COVID, a very difficult time, and we're keeping you all in our thoughts. And my next question, I'm going to start with Julia, but it's open to anyone. So what were your first thoughts when the vaccines came out, and what were some of your concerns, and how are you overcoming some of these concerns, or what kind of information helped you become more comfortable with the vaccine, or if you're still in that process, what does that look like?
Yeah, so I'm glad we're having this conversation, and I know Regina is too, because I think I've been really open and honest about some of the conversations that we were even having earlier today when it was just the medical providers about the mistrust in our community, and how we can really trust the government that really in many ways have failed us and have proven to utilize us as guinea pigs in so many different ways, right? So there's that reality there that it's hard to, especially as an elected official, to know that so many of my constituents and even sometimes even myself feel a little bit worried about, like, when I first heard about the vaccines coming out, my first thing was, well, I'm going to Wellesley. That's where I'm going. When they get those shots, I'm not going to get the one in Dorchester. I'm going to Wellesley, or I'm going to go to Brookline. I'm going to go anywhere except the hood. And so the fact that I felt that way spoke volumes to just kind of the realities that people feel about the vaccination. And however, I do know how important it is in terms of just the efforts that have been made here in Boston in particular to get more people of color to sign up to get vaccinated, and the effort that's being made by people who are in our community leaders, people that we respect, that are stepping up and taking the vaccine and helping us see that if they can do it and nothing has happened to them, they haven't grown an extra arm or an eye or anything crazy, because we're like, oh my God, conspiracy theories, you're all gonna start head spinning, but like nothing has happened so far. And so I think that that the fear is easing in a lot of communities. People are feeling a little bit more comfortable with the idea. And myself as an elected official, I also understand the responsibility that I have to be a leader, and to encourage my community to step up and to get vaccinated. And I participated in a video. Regina, I know you'd be happy to hear. I participated in a video encouraging people to go get vaccinated. My mom got vaccinated. She's gonna get her second dose soon. And I've come around and I'm waiting for my turn to do so. I have asthma, and so does my daughter. So I know that we qualify through that lens, but being an elected official, I don't want anybody to think I'm skipping the line. So I'm waiting for that, like, okay, when they open it up for everybody else, so that I can go get that shot, because I think it's important for me and for my family and for my community to get vaccinated and be healthy.
Thank you. Real quick, I'll jump in. Thank you, Councilor Mejia, for sharing that. And I remember, as my emerged sister, as myself, Samantha, and Julia, we're all emerged sisters class of 2019. Shout out to Emerge, but really wanted to, we had a call earlier this year, and we were saying that there's so much challenge around the vaccines, not only just the rollout, the hesitancies, the mistrust in vaccines across, Black and Brown communities. And we knew that we had to do our research, right? And that was in a conversation that was with Regina and another medical professional. And it really helped us in learning more about the roles that we must take as elected officials, right? As leaders in our community, and kind of just the messaging around vaccines and how we're sharing our own hesitancies and what does that look like, right? Because that is super real. And I know I've been talked to, checked, whatever folks want to call it, in terms of my constituents saying to me, if they thought I was an anti-vaxxer or whatever the case is. I'm not. I have been vaccinated. I am fully vaccinated, which I am proud to say that. But it was after doing a lot of research and speaking to a lot of folks. I had do my education, right? I had to do that in order to feel comfortable with the with being vaccinated. So I just wanted to jump in there and say that.
Yeah, and I think that's so important to share, as all of us as community leaders, like our own hesitations, it's, something that, as our medical professionals said, is very safe. And I know I've had family members get vaccinated. I'm waiting my turn, patiently. And, similarly, I've also heard from a lot of young people that they're hesitant to get the vaccine because of the quickness of the process. And it has been, fully vetted and everything. And I will be definitely excited to get my vaccine and be able to share that with people as something that they should do. I did want to pass it to Tony if there was anything else that you wanted to add around, what were some of your first thoughts when the vaccines came out? What are they now? And anything else along those lines that you'd like to share?
I think my initial thoughts aren't too different than my thoughts right now. It's still a level of apprehension. I think, to be transparent, I sit here as a Black man. And when a government that hasn't historically engaged me has telling me that I should do something, I do that with a level of resistance, right? And so our organization created the need. We heard the need to have more access to having the vaccines for the community. So we organized some efforts around that. And one of the things in which we were very adamant about is we were hearing from our constituents that 75% of the folks really wanted it. And so we couldn't kind of focus on the 25% who did, right? So it was like, let's figure out how do we find ways to engage our local officials, both elected and in some cases appointed through maybe the health department, to identify those folks who want the vaccine, provide them access to it. And may I just say is that I think that kind of like, what we see in our industry right now. I mean, I sit there as a man, so I understand that as a man, if I don't acknowledge the fact that there's equal pay day, that says a lot about my blind spots. And so we think about the folks we think about our vaccine drive, 75% of the folks who are there were women. And oftentimes they are left to hold the burden. And I think that we needed to acknowledge that and lift that. And one of the things in which I thought about the vaccine rollout, even in the city of Cambridge, a lot of the signs were of males. And I think we got to think about just the imaging around in terms of, if I'm seeing billboards that are like, get vaccinated, and I just see men and men and men, I may feel that I'm not a part of the conversation. So I think it's important to think about the marketing, the rollout, the communication, but actually also acknowledge the fact, I think it was mentioned earlier, there are a number of insecurities and blind spots around not just historically the relationship that Black and brown folks have with the medical fields, but how Black and brown folks feel like they're dealing with public entities. We have a adverse relationship with policing. We have an adverse relationship with schools. And we quite frankly have had not as bad of a relationship, but if you look and do research, one with the medical field. What I do think has been a brilliant thing that's happened through this is that the doctors have come forth as human. They haven't come forth like, we want you to do this, and if you don't do this, you're a bad person. Oftentimes that happens in other entities. And so it's been exciting to listen and to meet doctors who can kind of speak to me in layman's terms about the vaccine. But I'll be frank in that, I don't know how I feel because, when we think about, we can't get policy through to make sure we have safe schools, but we can miraculously do things in the science field. Obviously, we either have to have the scientists run the country, or we have some other folks doing really bad things. So we provided access for the vaccine for folks who wanted it. I'd be disingenuous if I said that, I'm a believer. I don't know. And I think that's the best thing I can say. And if I'm going to be honest and vulnerable, I'll just say, I don't know. I'm still on the fence about everything. So that's where I am.
Well, we greatly appreciate your vulnerability with us and sharing your thoughts. I think that's one of the reasons we wanted to create this space, to have a dialogue. And I feel like you just said, right, oftentimes it's like, just do something without a discussion behind it. And that's so important. The next question we have, I'm going to ask to Pastor Talas next. So what conversations are you having with people in the Black and brown communities about the vaccines? What questions have people raised to you directly? And then also, if any of you have been vaccinated, if you could also share your personal experience with that as well. So, Pastor?
Yes, Councilor. I can see easily the spread of a lot of myths and unreal fears in our community through social media. And for example, they will change your DNA with the vaccine. They will kill you with the vaccine. They will do something very bad with you through the vaccine. And a lot of people came to me and say, what do you think about this? My answer always was the same. We have been vaccinated for years. And just now we will have this position and they will try to kill us through this vaccine. It's too much conspiracy theory for me, okay? And of course, I already vaccinated. I received the 2 shots and I'm okay. The state of Massachusetts invited ministers and I say yes. And 2 weeks ago, the Board of Health of Marlborough asked to us to make a survey in our congregation, and I have to ask them to answer the survey. And when I was tell them about the survey, I said, people, that's my thoughts for you. We have to be open for this moment. And actually, because you have a lot of space in our building, the Board of Health of Marlborough is still thinking to use our congregation as a place for vaccine. And I said, yes. Our answer was yes. And I said for my people, be willing, be open, please answer the survey and try to understand. We are from Brazil. So in Brazil, we have a large carols, vaca, boi. Our carols is huge. So, and Pfizer vaccinated all of our carols in Brazil. So if the Pfizer try to kill us, probably they use our cows in Brazil, not this kind of vaccine. So don't eat food, this kind of food or meat and of course, Brazilians love meat. That's the reason, because I try for this side. And they say, oh, they use Pfizer vaccine in our carols. Yes, they use Pfizer vaccine in your carols. So you are eating this food, you love this meat, and now you say, I'm against the vaccine of Pfizer. Oh, really? Just now you are thinking about Pfizer is bad for us. So it's a way to try to open their minds. But about my congregation, and when I said I was vaccinated, they say, oh, yes, thank you, Pastor. We are open. If you say you received, and how you feel, I say, pretty good. I'm well. So it's hard. There is a lot of unreal fears around them, but I'm trying to help them. That's my position as a spiritual leader.
Well, thank you. I know everyone in Marlborough and the Brazilian community greatly appreciates your leadership. And I want to turn it over to Councilor Mejia and then Rosalind to also share, as I know they have some reflections based on the conversation as well.
Thank you. I just kind of wanted to quickly just thank Tony for his complete honesty and transparency. It's really hard for me as an elected official to keep it 100, because sometimes you're like, you're supposed to be saying this, but thank you, because let me just tell you that when they invited me to a little private meeting a month or two, I was like, oh, please, y'all are crazy. The rollout didn't reflect us. Like all of those things that you talk about were right on point. However, with all of that being said, and what I have seen so far, and seeing Ayesha getting it, and so many other folks that I respect and value, and hold in high regard, that has definitely given me a level of comfort. And then there was also some work that was done by the Black Boston COVID Coalition in the city of Boston, because let me tell you this, is that, not to get political, but the way things were rolled out, it was not with a racial equity lens, and the people who need it most were least informed. And so thank God for the Black Boston COVID Coalition efforts, because they opened up the Reggie Lewis Center and have done an amazing job at communicating to our people about access to the vaccine, why it's so important, and it was more culturally competent, and the communication was more reflective of what we needed to hear. And I think that had had the state or those folks who were at the table had more people that were like Tony, like people like Ayesha, like people like people who are living these realities, then I think that would have been a whole different conversation, and the rollout would have been more culturally competent and reflected, and we wouldn't be trying to still get people in this point to decide whether or not they're even going to get vaccinated. So I think that if there's anything that we can learn is making sure that the next time we're in a situation like this, that it's not just about having a seat at the table so that you can flip your lip. It's about making sure that you create the table and create space for people who are living these realities to be able to say, nah, that's not going to work for me. Here's what, this is what would work. And I think that that is one of the biggest lessons that we can all take away from this process, is who is at the table and who's dictating what that message is. Would have prevented a lot of this.
Thank you so much. And we greatly appreciate those comments. And I'm so grateful for, that conversation we had, I guess like over a month or so ago, where we all were like, what's happening with the vaccines? Let's talk about it amongst a lot of different people. And I think it's so valuable that, that the efforts are happening, and there should have been much more of a racial equity lens. And I appreciate you bringing that to the forefront. Rosalind, do you also have reflections as well?
Yes, I do. So I have also been fully vaccinated. And when I have the conversation with my family about doing it, I have had in the beginning, I was not getting it. They couldn't make me get it. And then, as COVID went on and it kept going on and on, I decided to take to get the vaccine. So when you're having, again, like you said, Julia, that when you're having these conversations, you have to meet people where they're at. You need to explain to them in a way that they're going to understand. And I think it's just so important in communities of color. It has to be somebody they trust, and they have to, like Talis, somebody you trust. They're going to ask you, and then as long as that trusted person has the information they need, that I think that's going to make the difference. And I am a firm believer on making change one person at a time. And that's something that I've always done, and kind of just try to be my mantra, I guess. So it is extremely important in meeting people where they're at. And then equity, like you said, there was no place that's people of color or people who are socioeconomic, people who are have socioeconomic difficulties. They're working 2 jobs. They don't have time to try to get on and get an appointment. And then the first ones were like where Gillette was like one of the first vaccine sites. Who nobody can get there. I mean, it was a little crazy, and just the equity was completely not there. It was blatant. It was just blatant. So my hope is that they will, as we continue to get vaccinated, because we have to get to that herd immunity, that when it's time for the people who have been on the front lines out there, making sure that while you're staying safe, that you have essentials like people who work in stores, when it's time to get them vaccinated, that they have a van go to the store and vaccinate them there. So just to make it easier for it to reach that herd immunity.
Yeah. And I know we're going to do a Q&A, but I'm going to have to be leaving soon because I have I came here early thinking, so I'm going to have to leave.
Julia, you were great. So thank you. Feel free to add any other thoughts.
Yeah, I'm so sorry. Yeah. I got double booked up in here, but I do want to say one more thing. And I was talking with someone earlier this morning. Now this has become the topic of my obsession. As we start thinking about vaccinating and getting people out there, is that this whole idea that people have to log in or have a phone or get signed up, all of this is about privilege. Because there's some people who don't even know how to read and write even in their own native language. So let's keep it 100. We need to really make sure that we can remove barriers. And the other thing that we need to think about is that same day, you should be able to go onto a site and get your vaccination right there and then, right? Like there needs to be, we need to build the infrastructure for same day vaccination, and that we could do so even if it's just a pilot site. because we're missing out on a lot of people who don't have access all the time. And sometimes I've heard that people get a phone call, you get 20 minutes to get to the site because the person that was supposed to be there didn't show up. So they got a whole list of like, oh, you can, and then you have to just, you know, leave, drop everything to hurry up and get it. It's just not sustainable. It's not culturally competent. And I think that even though while we have access to it, and I'm grateful, I'm not complaining. I'm just saying we need to fix it a little bit more and make it a little bit more equitable so folks can do same-day vaccination. I think that we're sophisticated enough. We should be able to figure out how we can do that to make it happen. And if that's happening already somewhere and I don't know about it, can someone tell me? Is it happening anywhere or no?
No, it's not happening. I mean, but you know, like you said, we need to get that infrastructure. We need to make that happen. And we know that that has been a huge fail on our state leadership. And it's really just unfortunate. And we have wonderful community leaders, like many of you on the call, like Tony from My Brother's Keeper, who has been organizing and setting up spaces and places for the community to come together to get vaccinated, and helping to get educators vaccinated who have been struggling, and really just finding so many challenges around to navigate the process of getting in. And so really working around the clock to support our communities, those who may not be that tech savvy, those who may not be, you know, English is not their first language or whatever the case is, it really is important for the community to help and support all of our neighbors in making sure that they get vaccinated. Those who want to get vaccinated should be vaccinated and should be those that are first in line, especially our most marginalized communities. And we have to do a much better job of setting up our sites that are convenient and in the locations that are close enough for our residents to get to. I mean, for individuals to have to travel miles and miles away, I know that was my struggle. It was like either Greensfield or Gillette. And I was like, what? I live in Cambridge. I don't want to go to neither. And then what happened the very next day? CVS over at Alewife opened up. And I was like, praise God, you know, so those are the things. And I mean, I waited a couple of extra days and able to, you know, in order for that to happen. Tony, I'm going to jump to you real quick.
Yeah, I mean, I think, you know, to the council's question, I mean, one of the things, and it's interesting because I'm often in contact with Shauna Bryan and Shauna's my cousin actually, and Cheryl Clyburn and others about some of the things in which they're doing and which we did. So one thing that I think we have to take out of it is the political minutia that comes with all of this. One of the, you know, my colleague and I, Ty Belletti, and Tufts Medical School, and Dr. Wayne Altman put together a vaccination drive. And essentially the idea was to model. Initially, we wanted to vaccinate up to 300 people. And we believed that we could do it in under 90 minutes. And what we did, we actually proved ourselves wrong. We weren't able to get the space that we thought we could have gotten, should have gotten. We were able to vaccinate 112 people in less than 45 minutes. And so these are things, and we have pushed on the city to ask the question of why can't we get this space for 1,000 people? And, you know, just to be frank, I'm not a politician. I'm a public citizen, a private citizen. So I can say things and people may be mad. It's all right. I don't have to worry about people, you know, supporting my campaign. So we have pushed on the governor's office to say, look, why don't you give us 1,000, 2,000? Why can't we do this every weekend or twice a week? And what happens is not just the governor's office, but we get caught up with egos, right? And so you got folks who are like, well, look, you have to go through these 4 or 5 bureaucratic steps. And unfortunately, what we haven't looked at in this moment is essentially asked the tough question of why haven't we utilized the ingenuity of community activists in this moment and to kind of create an olive branch? Because there are things that the councilor can get and help me understand from a legislative standpoint that's going to help us drive this work. But there's also some things that we can do on the, you know, boots on the ground. One thing that we do with My Brother's Keeper in Cambridge, we're talking to My Brother's Keeper 617. We're talking to, BAM in Boston. We're talking to a number of individuals across the bridge in Medford, you know, in Somerville. We don't get caught up with the lines of demarcation. We're looking at in terms of how can we get folks to these spaces to make sure they get vaccinated. Just to be clear, 63 of the people who we couldn't get on our list went to the Reggie Lewis Center. and some weren't individuals who could get there on the train. We had to organize, you know, car drives, right? We had to kind of organize with our churches. So I think that, and let's be clear, and everyone, you know, I'm not an anti-vaxxer, I'm just apprehensive. And so part of the problem is in terms of folks feel like, okay, if you don't get this vaccination, then you're anti this. I'm not a politician. I don't need to take a photo out with a needle in my arm. That's not what I'm doing. My job is to get the people to the place who want the vaccination and to make sure they get home. And so we provided food. We provide, you know, we provided a number of things to music. You were there, School Committee Member Wilson. We try to make it a party because we're in shelter in place, and folks are looking at this, as the counselor had mentioned and others. We're marred in a number of social and emotional supports that haven't been tapped into. And what we didn't want to create was a level of trauma bonding. Like, I'm going through worse than you, or you're going through worse than me. So what we did is essentially said, look, we broke up the gym into essentially 8 different quadrants. And every quadrant had, I think, 11 people. And of each quadrant, you essentially had 3 or 4 nurses who you know, and other officials, medical officials, who were able to, quite frankly, prick folks. And then when they come back on April 3rd to do their second shot, they're going to be in the same spaces with the same nurses. So you create a level of what? In that brief moment, people have name tags on. There's a level of humanity in that space where they don't feel like they're sitting outside of, you know, Gillette. A lot of our folks don't have cars. A lot of our folks don't have, you know, an individual who can kind of come to their aid. I understand my level of privilege. If my mom wasn't able to get the shot, at the Cambridge Community Center, I would have took her over, you know, to Roxbury, or I may have had to drive her, you know, to Worcester, because I have the opportunity and access with my schedule to do that. And I understand that privilege, but a lot of folks do. Overwhelmingly, the individuals we worked with. So to the council's point, we have to humanize this perspective. I know that we live in a digital particular space, but we are best when we're analog. And so I think it's very critically important that we shift how we market, but we also stop allowing ourselves to be caught up with the politics. I mean, we wanted to make sure teachers got the vaccination. The steps in which and I'm speaking for myself and I'm speaking as a member of MBK, because I get some people upset in Cambridge, but that's all right. We had to go through a number of just stupid steps, and excuse my language, stupid, to get teachers vaccinated. If you're saying that we have another allotment, well, not we, in terms of we are being able to leverage based on our wait list and allotment of individuals, you know, why do we have to go through these arcane steps just to get people on a list? I'm fine, get them on the list, but I have to call 3 or 4 people, and you may not like what I have to say, so I have to have my colleague email this person because they have a better rapport. Bottom line is just put this in. You know, when we want something that we want, we can do a Google Doc. So I just think we need to be courageous, and we need to follow the brave work that has been done by folks like Dr. Crittendon and others, but move away from the politics. I mean,
Thank you.
Folks
Thank you so much. Thank you, Tony. And thank you for your richness. I mean, I've been a part of this and sharing in the work with you, and I appreciate the work that you and the other folks from MBK, the work that y'all are doing has been remarkable. Dr. LaRocque.
Thank you. Well, you know, I just wanted to raise up what Tony is saying and say that as a health professional, I fully endorse the description of our failures in the state to elevate the needs of the communities that have been most affected by COVID. I mean, this is what structural racism in the healthcare system looks like. The vaccine rollout that we've had in Massachusetts. We have had a rollout that is oriented towards tech-savvy people who have transportation and who speak English. And it is only with immense political pressure on Governor Baker that we have seen a change, and the change remains insufficient. And we've heard that, I think, from people on this panel, and I've seen it myself. I will say, I'm a doctor. I am not able to influence the vaccine distribution system in this state, but I have been knocking on doors in Chelsea for the last 4 weekends, educating people, talking to people about the vaccine. I should be delivering the vaccine. It is appalling to me. We have not been able to take the vaccine and put it into the arms of the people who need it the most. And that is a failure. And to say that it's anything other than that is just not true. And so if people are concerned that individuals are hesitant about the role of this vaccine, the way you make it a priority and make people understand how important it is for their health is to make it available to them. And we have had real issues with that here in Massachusetts. So thank you for what you've done, Tony. We should be doing a lot more of that. And it shouldn't be done by people, you know, doing mutual aid for vaccine delivery. It needs to be done by our infrastructure, but it hasn't been.
Yeah, thank you so much.
I know Dr. Callahan also has some comments, and just before we have her transition, I wanted to say that we're going to move into more of the conversations between community leaders and medical professionals. So feel free, any question is open to everyone here. And I did just want to also amplify a lot of the comments that were already made. I mean, it's still ridiculous in many ways that, you know, local municipalities have created all of these vaccine or public health plans and then, you know, are not able to administer them anymore in their own communities, and that we have to go to these mass vaccination sites where transportation is an issue. And I think COVID-19, the vaccines, right, did not, you know, stop any of the structural problems and systemic racism that already existed in a lot of our systems overall, and in many ways just amplified them. So, you know, to just put Band-Aid solutions is not the right point. And I am so appreciative of all the work that's been happening. And Tony, thank you so much for sharing. Dr. Callahan, I'll turn it over to you.
Yeah, and I'm welcome to take the questions that you had for the whole group. But the one thing I am really concerned about is the connection between hesitancy in our communities and lack of access, because the narrative is starting to shift. Because if the narrative can become they don't want the vaccine, then there will be a further shift away from making it accessible. And we have to be very, very, very conscious that that narrative is shifting towards a rejection of the vaccine by the very people who need it. And addressing that and facing up to that is key in how we go forward. I was privileged enough to be one of the volunteer vaccinators over at the Reggie Lewis, and it was I tell you, it was remarkable to have we had about 12 to 15 African-American, they're mostly African-American actually, physicians, and primarily female physicians that were ready and willing to vaccinate the community. But what was very interesting on my first day there, it was during Black History Month. It was an effort to put it, you know, within the context of people of color. The majority of the people I vaccinated were not of color. They had driven, one person drove for 2 hours from way out Western Massachusetts. And everybody needs the vaccine. Do not get me wrong. Everybody needs the vaccine. But it is interesting that we can't seem to get past white privilege. We are having trouble getting past white privilege. And going forward, I think that is probably why we're not being so creative, because there is a lot of genius and brilliance in communities other than the white community, okay? And we cut our nose off to spite our face by not recognizing and tapping into that brilliance and tapping into the creativity. We know how to get things to our community. We do. I mean, we've organized within churches for many, many, many years around very, very important things. And so if we begin to utilize some of those same mechanisms, and yes, we don't have in a pandemic, you don't roll out anything. That concept of rolling out in the middle of a pandemic, to me, is sick. You know, you drop things everywhere possible. You get vaccine by any means necessary when people are dying in the hundreds. So I totally agree, Tony. I appreciate your rage, and I appreciate your vulnerability and demonstrating, because it's outrageous and unnecessary, quite frankly. So I look forward to continuing my vaccinating, my new vaccinating career. I will go wherever I need to go to vaccinate folks. So I look forward to hearing some of the other questions and concerns.
Thank you so much. And I think that was a very eye-opening even story to hear, right, for everyone watching, right? The fact that the people that you were able to be helping vaccinate were coming from really far away. And I think that just contributes to the problem of vaccine access and having it be equitable. Does anyone else have any kind of responses or reflections based on these comments? I don't want to move into another question and unless people want to move forward, but I want to give time for some of our other panelists who might want to respond.
I just maybe will make one quick point. One other issue of concern I have is this kind of idea of scapegoating communities of color, saying that they're not using vaccines enough. And as we're trying to get to herd immunity, there is some great, Rhea Boyd is a really great racial justice educator who had this great op-ed in the New York Times. And so I think the hesitancy story around communities of color, it's like there's a spotlight on it somehow. And actually there's large swaths of white communities, rural white, people who are actually saying they're not going to take the vaccine at a much higher rate. And so I think our conversation about this is fraught and has been, there's this history of scapegoating communities and saying because of this we are not getting that, and that is not the evidence I'm seeing. I'm seeing the overwhelming story that people want to get the vaccine and want access to it, and we need to offer it with ease, with good information from trusted messengers and people who will supply it, and I think that's really where we should be focusing our efforts.
Absolutely, and thank you all. I feel like everyone is going to get so much out of this conversation if they're watching it live or afterwards, and appreciate everyone's candor with us collectively. Some of the questions that we have on the chat, I'm going to kind of take collectively. Some of them have to do with the vaccine itself. And so I just wanted to, and this is open to anyone. So we had a couple come in around, I'm going to read it word for word. In a specific case, such as a person who might have allergies to the flu shot, should they be concerned about the COVID-19 vaccine? And on that same front, for people who might be concerned about differentiation between vaccines, do certain vaccines have different side effects than others? So those are two kind of medical specific questions, if anyone wants to jump in and answer that.
Well, I can answer it very simply. I am not a researcher, okay? So, but I will just start out by, if you have an allergic reaction to the influenza vaccine, my sense is that this person is talking about egg allergies, which has been for a long time. We've taken care not to vaccinate some individuals that have had severe reactions to egg, because the flu vaccine is cultured in egg. This is a different technology. We're not culturing this vaccine in anything that would be that you would be allergic to. There are oftentimes some. So yes, you can get the COVID vaccine if you've had an allergic reaction to the flu vaccine. However, there are some local inflammation at the vaccination site that is a sort of an allergic reaction, okay, that you might have, but that's not related to having any type of a food allergy. And so we do see some of that. And if there's a nut allergy, we do recommend that there has been situations where folks have had anaphylaxis resulting from the vaccine. That being said, it's very rare and treatable with an EpiPen. So folks that come to be vaccinated, they are asked to bring their EpiPen if they have severe nut allergies.
Could I just add to that? I'd just like to add that we definitely will observe you for 15 minutes. Those of you who do not have any types of allergies, 15 minutes, you're in a room where you're medically observed. But if you have any type of allergies, we will observe you for 30 minutes. So we look at that, if an allergy was to kick in, we would be right there to take great care of you. And we haven't seen that in the, the first 1,000 that vaccines that I was part of the vaccine clinic. We didn't have that issue at all. And it's very infrequent that we see those issues occur.
If I could add one comment to that, which is that I think it's important to acknowledge that we have identified this allergic reaction to the vaccine because of having a surveillance system, a system in place to monitor people who've gotten the vaccine. You know, millions of people have gotten the COVID vaccines at this point, and it's a sign of our surveillance system working that we have detected this very rare adverse event, and we are watching people carefully for it after administering the vaccine. And it is very rare. I mean, I give intravenous antibiotics to people all the time that have allergic reaction rates that are far, far higher than what we've seen with the COVID vaccines.
Thank you. And I will only say, as someone with a lot of allergies, I will be getting the vaccine. I did call my allergist and they said I should get the vaccine. So just want to speak for myself with nut allergies, gluten, a lot of other stuff. I'm getting it, and I hope that those with allergies are going to get it as well. And sadly, we are getting towards our last kind of chunk of time together, and I wanted to make sure that we had an opportunity to have every single person answer our last question, since it might take the full 7 minutes. And so for those who are like maybe just tuning in now, you know, you finished your dinner and you started to go on Facebook and you saw us, the question I want to make sure that we answer is, if there is one takeaway for those who are watching, what would you want to make sure that they know about our conversation? This could be something that was highlighted earlier that you want to come back to, or it could be something new that based on the questions we weren't able to get to yet. So I'm going to start with Pastor Tallis, and then I'll kind of go along the line and call people so that we can have your comments. And Ayesha, I hope that you will go as well, and I can go too.
What is the question?
What is one thing that you want people to know after listening to our entire conversation? What is the one thing that they should make sure to remember?
I believe we have a very positive conversation, talking, and I believe the main point, the main line is we need to be vaccinated. We need to be proactive for this situation. The vaccination is the only way out for this pandemic. That's my opinion. I'm agree with you guys. I'm with you guys, and I'm really happy to be here. And when I was listening, our scientists and medical staff was so good because they are so assertive, so sure about everything. I'm very happy to listen them. Thank you, all the medicals, doctors present. We are wonderful. We are wonderful. I really thank you guys.
Thank you so much. And now I'm going to turn it over to Jill Crittendon to go next.
Yeah, I think the takeaway that I would like people to have is just that vaccines, many different types of vaccines, are important and have saved just millions of lives, and they continue to be developed. There are vaccines now against cancer that kids get, the HPV vaccinations, those have saved lives. People are developing more vaccines against other types of cancer. It's working for COVID. It's something that is just, as a biomedical scientist, is I wouldn't say that it's a miracle because it's based in many, many years of science, but it's a tremendous technology that I don't want anybody to think is dangerous, and to realize how many lives it saved. And I hope everyone will take advantage of that.
Thank you so much, Dr. Crittendon. And I will now turn to Rosalind Baker.
I would like people to take away from this that if they are hesitant about the vaccine, please go to somebody you trust that's going to give you sound advice, because it is important for us to get the vaccine. And if, just like Tyler said, that's the only way out of this. And that's not just here, that's worldwide. If we don't get enough herd immunity worldwide, this is not, we're never going to be COVID free. We may never be COVID free, but at least we need to be able to travel amongst countries and not worry so much. This is a global problem. We have to act locally, but it's a global issue.
Thank you so much. And now I want to turn it over to Dr. Callahan.
Yeah, I think the take home for me is that we hear you. I hear you when there's fear, when there's, I hear you. I know where you're coming from. And I think be assertive and say what you're feeling, speak it. Don't be afraid to be looked upon as being ignorant in any way. No, I hear you. And so when we're talking to folks about anything, any decision that they have to make around their health and their wellness, we got to hear what they're saying, and we've got to respect where that fear is coming from. And then we have to show and demonstrate by example, and through science and through facts, and help people get over that bridge from fear to facts to make a very to make the best decisions for their life in a lot of things, vaccines and otherwise. There's a lot of fear in this society. So the take home is just, we hear you. We hear you.
Thank you. And now I'm going to turn it over to Professor Tony Clark.
Just call me Tony. I think Dr. Callahan had mentioned something that really resonated with me in terms of breaking down the political stuff, just getting shots in folks' arms. So I just think, let's just get it done. I think that's what this has said to me. Let's get it done. Let's move away from the politics and let's just get it done.
Thank you. And Dr. Basu?
This has been a heartbreaking year. It's been a year full of tremendous pain and suffering, and we have gone through a lot, and it makes me really mad to know that structural racism is the heart of what has made this so bad, and that's played out through economic issues, essential workers having to have exposures they shouldn't have, housing policy, air pollution. And so we have a convergence of major crises, including our climate and our economic inequities. And we've got a lot of work to do. And we've got to do deep work, and we've got to learn that this pandemic has activated all the fault lines of injustice that have always plagued us. And we cannot look away from the hard things that we're seeing animated right now. This vaccine gives us opportunity to cool this pandemic down so that we can get to work on doing the big structural work we must do moving forward.
Thank you. And Tracy Rose-Tynes, if you want to go next.
I just have to say that I'm 4 weeks into getting my second shot, so I am fully vaccinated. And yes, it was one of the most exciting days of my life, but I want to just say, I had to do my own research. And even though I work for the Department of Public Health, I didn't run to get my vaccine. I had to do my research. I did my research. Over a decade, for the vaccine that I had, over a decade, I believe the science. The work had been done and prepared for us today for this vaccine, for us to be able to say it's safe. And I felt so great about it. I convinced my 89-year-old mother. I feel like this vaccine is that safe that I would have my precious mother have this vaccine. So my mother on Saturday will have had her second vaccine. I get to hug my mother on Saturday for the first time in 1 year. That's what that means to me. And I'm emotional because my mother's 89. It's going to be a reunion like I've never had before. And I'm going to hug her probably for an hour. And I'm going to celebrate the fact that she is still here. She is well. She never got sick. I protected her like she's my baby cub. I want you all who are listening, if you're hesitant, know that I did the research, so much so that I convinced my mother that this is safe. And I want you all to be able to hug your loved ones and be safe. So, thank you.
Thank you. That was so powerful. I feel like we all felt that energy that you just brought. So thank you. Dr. LaRocque, do you want to go next?
Sure. Well, thank you for the opportunity to be here and listen to all of the panelists. I've learned a lot also. And I'm sorry, because I'm an infectious disease doctor, I have to end with just a clear note to say that the pandemic is not over. It is not over yet. The vaccines are very important, but they are only one part of our toolkit for controlling this. And we are far away from having enough people vaccinated to control the pandemic with vaccines alone. So we cannot forget all of the other things that we have to be doing that are so important. And we are a long way from enough people protected with vaccines. So I just want to underscore that.
Thank you. I think that's a very important note. I do want to turn it over to Ayesha for her last thoughts, and then I have some final thoughts as well. And we're just really grateful to be able to have this conversation. So Ayesha, turning it to you.
Yes, thank you all. Thank you to the panelists, all of you. Just thank you so much for answering the call, answering that email, and joining us here today and sharing your expertise, your knowledge, your skill, your passion with the community. That is just so important, and our community needs to hear that statewide. Folks need to hear the messages that you are sharing, the vulnerability that you are sharing, your truth, and how we're going to be speaking those truths into power, right? And that's the important piece here as well. To Tracy Rose-Tynes, thank you so much for sharing your story. I might have to plug you in on my mother because she ain't feeling my direction. But you know, it's really heartfelt stuff, and it's a lot of work that we need to do here in getting those who need to be vaccinated. And so I think it's important that you do your education, that you do your research. That is the only way that you will feel confident. And for me, it was important for me to lead by example. I want the community to see someone looking like them who is getting vaccinated. And so I did not take getting vaccinated lightly. It was painful in terms of the emotional turmoil that I went through. I prayed 1,000 times over. And that's those things that you have to do to comfort yourself. So do what you need to do to comfort you. And I hope that this conversation is something that you're actually adding to that piece, that toolbox of your own, to say, and today I can feel one step more closer to confident and comfortable with being vaccinated. So thank you.
Thank you so much, Ayesha. And, you know, I can't really add anything that wasn't already said. I feel like this has been probably the highlight of my week, and just so appreciative of everyone taking the time to be able to share their personal experiences, their reflections, their community work, their medical background. It's been so fruitful to be able to bring people together from across the Commonwealth. And I know Ayesha and I were really excited as friends and colleagues to come together with Marlborough and Cambridge, which I feel like oftentimes things just happen in individual communities, and to be able to have that across has been so special. And if I could leave with a couple of words as well, as you know, I would say with great challenge comes great opportunity, right? The pandemic has been one of the most challenging periods that we've faced, you know, in recent memory. And I would ask everyone who's watching to, you know, take that opportunity to give back, to hold your leaders accountable, to push for the things that we need here in Massachusetts for equitable vaccine access, and making sure that you're having those conversations with friends and family and neighbor, letting them know about your story, if you've been vaccinated or your concerns, because only when we talk to each other are we able to really move forward. And as Dr. LaRocque mentioned, right, the pandemic is not over. Please still abide by all public health precautions and mask wearing and socially distancing. And if people have follow-up questions, we'll be sure to share some resources out on social media afterwards. Some of our panelists sent them in advance as well. And we're incredibly grateful that you've joined us, and thank you so much for being here. I hope you have a wonderful evening, and I would do a virtual round of applause for our panelists again. Thank you so much. It's been such an honor to have you here.
Thank you all again so much for being here with us. Have a good night. We'll share this on YouTube as well as through our social media. And again, just thank you. Hopefully this is a to be continued. We'll have another conversation at a later date. Thank you all for joining us. Good night.